Previously on the Surviving Podcast.
For the benefit of those out there, how did this all, or what was your diagnosis?
I was diagnosed kidney failure stage 5. Bro, I nearly died.
Wow.
I couldn't breathe. And of course, being a religious person, the first person I called was my leader at church. The people in my house took me to a hospital. But when I got there, they checked my blood pressure. It was very high. It was reading around 250.
Wow.
You know, I was somebody who barely got sick. The highest sickness I would get is headache. From January 2022, that's where some symptoms started coming. And this time around, you know, whenever I wake up in the morning, I felt pain. I think that's what they call migraine.
Okay.
At the back of my head here, felt so much pain. Every day that I go out and come back, my feet will be full with my shoe. Very full. To the extent that I can't even pull off my trousers. Because it's full. The tip has a size that it's supposed to be. It will be like 4 times the size. So I have to lie on the bed for it to come down before I'll be able to, you know, get back to my normal state and then take off my trousers. I was supposed to start dialysis immediately. But I mean, the means wasn't there. The rule itself too wasn't there.
Now on the Surviving Podcast.
So my sister came. I drove myself to the hospital, but I was in pain. And of course, the vomiting was coming. So we had a pill. Of course, the back wasn't coming. So other than that, I would have to have another thing too for that one. You know, and I drove myself to one private hospital. That hospital, I wouldn't even recommend to my worst enemy. So I went to that. That's the hospital she was around. Hospital. Yeah, around La Paz there about. She took me there. They didn't do anything. Even just a common IV injection, Charlie, took them 30 minutes. They pinch here.
They were looking for the vein.
There was vein, but the girl didn't know how to do it. Eventually, a doctor came and then did what he had to do. And then they were able to put in the IV. So from then on, I lay in the hospital for almost 2-3 days. They barely gave me any medicine, and I was in pains.
Did they know that you had been diagnosed of
course, I told them. I was in pains. Just pains. So I think after the 3rd day, I told my sister, if you don't take me out of here, I warn her. So she went to pay the bills, and then the doctor came, and of course they discharged me and referred me to Rich. I'd been to Rich, so that was the right place to. So they took me to Rich, and of course, Rich, I stayed at Rich for almost a week. I didn't know what was happening. Eventually, my sister was telling me later on that they had put lot of machines on me. But of course, at Rich, the pain stopped.
Is it that you passed out or you were conscious?
I didn't pass. I was conscious, but I was always sleeping.
Oh, okay.
I was always sleeping. So Rich there. By the time I was leaving Rich, I could barely walk. It's like I was now learning how to walk. So Rich, you know, referred me to Confanoche because of the kidney disease that they had diagnosed me. So my sister was the only person who was taking care of me in Accra here, and it was becoming a workload on her. So they had to refer me back home. So I went to Confanoche, where of course I have family there also. And then at Confanoche, that they started dealing with me regards to the kidney failure. And, you know, in one of the sections, I'd been to there a couple of times for review here and there. And of course, they didn't have any medicine. There wasn't any medicine. All that they could do is to give you a lot of BP medication. I think I was on about more than 6 BP medication.
Wow.
Yeah. More than 6.
Is it that they struggle to keep the BP down? Or?
I think so. They were struggling. Some of them, I didn't even know how to pronounce the name. Yeah, they were struggling to keep
all
it
along,
down.
you had not started the dialysis?
Oh, for where? I think after my 3rd review, then they said I should go and see a counselor. At of course, the Confanoche there, one nurse like that. I wish I never met that nurse that day. That nurse just told me point blank, Of course, there were several people there, so maybe that's how they deal it. So that, Charlie, I mean, at the NSCA, what are you going to do? How are you going to sugarcoat it to make it any sweeter than it is? Because it's CKD stage 5.
So what did she say?
She said, you have to start dialysis. And for the dialysis, you'll be on it till you die. Or until you get a miracle.
So like a death sentence.
So I was just looking at her. Huh? Yeah, until you die or you get a miracle.
And she was supposed to be a counselor.
Oh, yeah.
Wow.
Yeah. And,
So what did you do after that?
I left there and I started looking for miracle.
Back to the miracle business.
Yes, and went looking for a miracle. So much so that I traveled for one healing session at Nigeria.
So you went to after exploring all the pastors in Ghana, then you went.
I didn't explore any pastor in Ghana because I didn't know any pastor. I didn't know any pastor that was actually healing people. Of course, if you know one, you can tell me about. I was so good there.
I wish I did. So you went to Nigeria?
Yeah, for 2 weeks. Interestingly, when I was going to Nigeria, all the edema has stopped.
As in the swelling?
The swelling, it has stopped completely. I will sit here for 3 hours, my leg will not swell. I will walk normally and everything.
Wow.
I went to Nigeria. That was the time COVID-2 was going, and so there was a lot of restrictions. But then I had done a contract somewhere for one client and I had made a lot of money. So flying to Nigeria was a piece of cake. Booked the hotel, stayed there for 2 weeks. I went for the healing session. Interestingly, at the healing session, I nearly died. Before the pastor would come and pray for us, my BP skyrocketed. I think when I was leaving home, I didn't take my medication because I knew that day, Charlie, I remember too. So I forgot. Let me see, I forgot.
So you didn't carry it with you?
I didn't take it in the morning and I didn't carry it with me. So I think about a few minutes before the pastor came on stage to start ministering to us, I had an episode. I'm in the air condition. This place, the air condition is not even working. Talking about the industrial air condition. That when you enter, you'll be chilled. I was sweating.
Wow.
Gosh. I was sweating profusely. Then I couldn't breathe.
You went alone?
I went alone.
Wow.
I went alone. I couldn't breathe. So they took me. They had set up a medical center over there. They took me there, and then they actually paid attention to me. So they gave me BP medication. When they saw me,
the church gave you BP medication.
Yeah.
The church.
Yeah.
Where you went for the healing.
Yeah.
For the miracle.
They had a medical team there
to give you BP medication.
Yeah, because it's a healing place, and a lot of sick people are coming. You are going to have people.
No, because
sickness.
It's a friendly conversation.
I understand where you're coming from.
You left Ghana.
Yes.
Went to Nigeria.
Yes.
To a church.
Yes.
For healing.
Yes.
And they gave you BP medication.
When the situation became very.
No, I'm just trying to.
Yeah, you picture it.
Oh, that's amazing.
Yeah,
anyway.
that's true. That's true.
I mean, I won't forget this one.
No, don't forget in a hurry. Don't forget in a hurry.
So after.
But I'm sure if there wasn't a medical team there, I could have come back to Ghana a corpse, But they did well. They did
on
well.
the medical side.
On the medical side.
But not the healing side.
Well, that one is a lot involved. This is spiritual. You can't really access spirituality.
Yeah.
So they gave me the medication. As I said, the machine that we're using to read was not reading.
In the church?
Yeah.
Wow.
So they took me to an ambulance there. I think the ambulance machine was able to read me. They realized, Charlie, the thing they had. So they gave me a lot of BP medication, and of course I became calm. They took me back to the center. I was still finding it difficult to breathe, but the same. I said, no, I didn't come all the way from Ghana to be left out of this healing. But what happened was that when the pastor prayed for me, all the difficulty in breathing and everything stopped immediately.
There and then.
Stopped. The way I was sweating and I was tired.
Everything stopped.
Everything stopped.
You felt fine.
I felt fine. When I came back, my leg was not swelling.
Wow.
So I knew, Charlie, at the end of I pick it.
Yeah.
Then, I think after a month or so,
Is it that they gave you some directions that you didn't follow?
there wasn't any directions. It was just the prayer. That was all.
Okay.
And I came back.
So after a month, the swelling started again.
Started again. This time around. So I think I went there in March. I think in April, May, it came back again. And this is where the difficulty also started.
And that was from between when you first met the doctor and he told you had to do dialysis.
Sure.
And that period.
Sure.
What was the length of time?
The doctor's own, if I'm getting things right, the doctor's own is somewhere in April.
Okay.
When assessment came. I can't really remember the dates and the times. Yeah.
But was it like after 6 months?
Oh, after that, before I went to...
No, I mean, from when you went to the hospital in Ghana and when you went to Nigeria and came back, what
Yeah,
was the
to be
span of
within
time?
6 months.
Like about 6 months.
Period. Within 6 months period.
So all this while there was no dialysis.
There was no dialysis. I began to swell.
Your feet or your entire body.
My entire body began to swell.
When you say
began to
swell, like you began
the
gaining
fluid
weight.
was building up.
So you began gaining weight.
Gaining weight make it sound as if
It's a nice thing.
that's a nice thing.
I get it.
Every part of my body
So like when you press, you could feel.
could feel it will just fall in like
Was
that.
it painful?
No, it wasn't painful. Pain wasn't part of it. It began to swell. And it took a while before I started dialysis. So much so that the swelling got to my balls. I have some pictures of my phone. If I show you, when I see it, I'm sad. Yeah. My balls, you see sheep,
Yeah.
the male one.
Yeah.
When they are going, you see the balls will be dangling like that. That's how my balls became.
That means there was no action.
Action for where? You don't even have that feeling. Up to now, I don't even have that feeling. Action is not part of the things even if you give me free match, the boss.
Over control.
Oh, the boss. Yeah. So, and one thing I would say is that, this sickness, you need hope. Yeah. Because I've known people who didn't even survive 2 months.
After diagnosis.
Yeah.
And because it was hopeless.
It was hopeless.
And what's the source
Even
of hope?
the money to go and do checkup to find out whether it's this sickness wasn't there. The money to go and do a surgery. To do that surgery wasn't there. So, one particular guy like that, I was in church. The guy died in less than a month.
After diagnosis.
He did 2 dialysis and he gave up. But what I would say is that for my part, I had my big sister. I call her Dinah, or Dinah, but she has been the angel in my life. Yeah. She has been taking care of me as if I'm a child. At a point, boy, I could defecate on myself. Yeah. It was that bad. It was that bad. But she was there for me. And even now, she's still there for me. Yeah. So you actually need somebody who decide that I want to hold the fort for you. Yeah. So it took me almost a year. One day, the nurse friend who directed me to see the doctor, she was coming to visit me. At this time around, I wasn't doing anything, just sitting on bed, and just sitting on bed alone, the way it affected my buttocks, all the fat at my buttocks left. Yeah, if I show you that picture of my buttocks.
So you became flat?
Flat, like this. Flat, terrible. These days, if I sit on a plastic chair, it will be paining me. If I sit for too long, actually, I have to stand up. Yeah. So fast forward, this lady came. She told me that she's coming to visit me. So when she got to my gate, she called me that she's coming. So I stood from the bed and I sat in a chair waiting for her to come. She said when she came in, it took her more than 15 minutes to wake me.
I think you were asleep.
Well, I thought I was asleep, but I was practically gone.
So you were unconscious, more or less.
Let me put it that way. I was unconscious. She struggled to wake me up. That's when she told me, Sam, you have to go for dialysis. That's when it dawned on me. Charlie, you better do the dialysis. And of course, at that time I had the funds.
From your contract?
From the contract that I did. I had the funds. So the next day, quickly, I went with my sister to one private hospital like that. And then they did the first surgery on my neck here. They put some tubes, my neck through to wherever it is supposed to go through. And then they did the first dialysis, I think the same day.
So they had to put some things like...
Some tube, they call it catheter.
Oh, okay.
Yeah, they call it catheter. So I did my first dialysis. And with the way I was swollen, they had to do 3 times a week. So I did first,
What is, for the benefit of those of us who may not know what it is, what is the dialysis thing? What does it entail? What's the process?
Okay, so there's a big machine. Let me put it that way. Normally when I'm going, I say, I'm going to machine. There's a big machine there where they have some tubes connected through to it. And then that machine is connected back to your body. 2 tubes connected back to your body. So your blood is drained through the tubes, goes through the machine. Then the machine cleans the blood.
Okay.
Because the kidney is supposed to clean the blood. Now the kidney can't do that job anymore because it's weak or dead. So the machine cleans it and then brings the blood back to your body. So you continue that process for 4 hours.
4 hours?
Yeah.
At every session?
Every session, 4 hours.
So do you sit or you lie down?
Well, the first hospital I went to, I lie down. And of course, you sleep.
The process?
Yeah, in the process you sleep. You sleep. So they will do it first session, second session, third session for the week. Of course, if you have the ability. But the way my situation was like, the way I had swollen, I needed it because when I was not doing the dialysis and I was home, at a point, I couldn't sleep. I couldn't lie down and sleep. I have to sit. If I lie down, it's as if somebody's choking my neck. Apparently, they say it's the fluid that is climbing. Okay. So it's as if somebody's choking my neck. Then I'll sit. So all throughout the time that I was not going for dialysis, that the situation had become so unbearable, I was just sitting down. And I was just dozing off. When I returned to Kakra with Menyate, it was happening, that way. But then when they started doing the dialysis, of course, I began to sleep and sleep well. So after a couple of sessions in Accra here, I went to Kumasi. So my first place that I went to was Komfanoche Teaching Hospital. Of course, these government institutions and the way they do their things. I sat on the machine, it's supposed to be 4 hours. I sat on it for 6 hours.
Wow.
The first 2 hours that I was doing, apparently the machine was spoiled.
So the machine wasn't working?
It wasn't working.
For the first 2 hours?
The first 2 hours.
Yet you had been connected to the thing?
Yeah, through the tubes on my neck and all that. So there was one doctor who was bold enough, or nurse, who was bold enough, walked in and then he said, "Oh, Charlie, but the machine is not working." He said, "Go, come to this machine." That time, Charlie, I need the relief. So I didn't even complain. Well, we have the mouth to complain. So I went to another machine, and then, of course, when I finished the session, one nurse told me, "Charlie, you have to go to a private clinic to get better dialysis."
Now, why did she ask you to go to a private clinic?
Because they had only 2 machines. One is not working.
The whole of Comfort?
Yeah, Comfort, 2. Wow. That's at that time. They had some in other rooms I didn't know.
And did you meet a lot of patients there? Was there a queue? Like,
I didn't see patients there.
okay, they book you.
No, they booked me. I booked for the dialysis. So I went to a private hospital, I think Dr. Anane's hospital. And of course, there, I started the treatment again. Well, thanks to my father then. He was driving me there. Every day, he'd take me there and bring me back home. Take me there 3 times a week. At a point, I realized, okay, most of the fluid had drained away. So I reduced it from the 3 to 2 sessions a week. From there I moved to another clinic.
So how much were you paying?
As at that, I was paying 500
per session.
Yeah, per session.
500 cedis per session.
500 cedis per session, and of course
you were doing 3 times. That's like 1,500 a week.
Yeah. No, there's this injection you have to take also. They call it EPO. EPO C. The EPO is a short form of it. So I was taking the injection. Anytime I go for the dialysis, because you lose a lot of blood. I think the kidney is also supposed to help to produce blood. Now you can't do that job, so you have to find alternative way. And of course, the injection was helpful. That's like 150 or so. So plus the 500, that's 650
per session.
Per session.
So give or take, you were spending about 2,000 cedis a week for the dialysis.
A week. That's 3 times a week.
Wow.
So
you had to do that every week.
Yeah, every week.
Which means that in a month, on the average, we're doing about 8,000.
Yes.
That's almost 100,000 in a year.
Well.
And you've been doing this thing for how many years now?
I think I'm going to my 3rd year.
So that's almost 300,000.
Thereabouts. Yes.
Wow. That's expensive.
Very. This sickness will turn you to a beggar. It will turn you to a beggar. Because at a point, your funds will finish.
Yeah.
And you can't work. No, it's not that you are lazy. You can't work. You want to work, but you can't work. Because at every time you are tired. Imagine when I was coming to the studio, I could barely walk from the gate to the ground floor. I had to sit down, catch my breath before I was able to climb the stairs. You are always tired and you're always sleeping. If I sit here more than 30 minutes, I will sleep. Yeah, so you're always tired. So making money really, it's not something that you get to do.
So it's a sickness that makes you spend money, but doesn't allow you to make money.
Make money. Yeah.
Wow.
So sometimes you have to find other means to be able to make money. As I said, I do advertising. One good thing about it is that I was barely doing, daily sales, going out and doing sales. Normally, I just do my proposal, push it to, advertising agencies and companies. If I get an offer, then I fall on it. And of course, I send people to go do this for me. Then when I finish, I get my something out of it. I remember when I was in Kumasi, one particular agency did help me. They hadn't met me before. Somebody recommended me to her, and then she said I should do, some advertising for her. But then what she said is I should pay finance. But then I had money. Yeah, I had money. But the money wasn't money that was static. It was being used every day. So I started the campaign for 2 weeks, and then of course they paid me. And so I was in Kumasi for almost a year doing dialysis from 3 sessions in a week. Now I moved it to 2 sessions in a week. Now later I came to Accra. But what brought me to Accra is another thing altogether.
What was it?
Bro, I was there one day when a friend of mine, I call him Senior, and he called me. He would usually check up on me because he knew my condition and all that. And I'd done a couple of projects with him, so we were friends. But then, of course, he seniored me, so I gave him that respect. He called me and said, "Sam, Charlie," he calls me Prempeh. He said, "Sam, in guy be from UK come, we in junior brought who had kidney failure, and then the one doctor for Soutium had treated him, and now he's okay. He's a herbal doctor." So when he said it, I hadn't exploited too many herbal doctors then. I think when I went to Kumasi, there was one that I encountered that the medicine he gave to me, it virtually drained the fluid from my body within a week. But after a month, there was no draining again. The what they call the creatinine was not coming down. The EGFR was not coming down. So it wasn't any better. So I stopped that medicine. So when he told me about this particular doctor, I called him. He gave me the number. He said he's a professor something. So I said, why not? I mean, at the end, maybe you're doing it here. Miracle is not happening here. Let me see. Refer to this, helper. Maybe they can help. So he told me it's 25,000 Ghana cedis.
Wow, for the treatment.
For the treatment.
That was supposed to make the kidney recover.
Yeah, fully recover. At least after 2 months to 3 months of taking the medicine, I should get better. So when he said, and then I had to use a lot of my funds. Almost a year in Kumasi, back and forth with all this, I used a lot of my funds. So I didn't have the full amount. I called a couple of people, of course, my family also, my old boy too. He's on pension anyway. So they organized something for me. And then, of course, I had something there. I added it to it, and then I came to Accra. That's what brought me back to Accra. So I went to see the doctor, and of course, Kasabebre. And I went there with my big brother. Kasabebre. I'm saying, okay, let's try it. So I paid the money. Of course, I signed some document, non-refundable, something.
Proudly brought to you by Sankofa Natural Spices. The Surviving Podcast.